Hello and welcome to the latest in a series of webinars from Reframe Cancer. Today we're tackling having sensitive conversations about cancer in the workplace. With me, my colleague Michelle Smith, and we're hoping this will take 30 minutes or so. We've got a lot to get through, so if it overruns a little, bear with us, and if you can stay with us, by all means. Also, there's an opportunity for you to post questions to us throughout the webinar. We'll try and tackle them if the topic is suitable there and then, or perhaps at the end. It depends on the number and how many come through to us. But let's just kick this off. We've got lots to squeeze in, so I'll just move on to my screen share, and we'll move on to the first slides. Okay, so speakers and agenda. I'll introduce my colleague Michelle, who's Head of Clinical Strategy here at Reframe. Michelle, if you'd like to give us a quick intro on yourself, your background and your knowledge, and equally how it might reflect the sensitive conversation topic that we're tackling today.
Yeah, absolutely. So I'm Michelle Smith, and as Sean said, I'm the Head of Clinical Strategy here at Reframe. So my role is to make sure that our SMT are aware of everything from a strategic point of view, everything that's happening clinically in the world of cancer, so that our care can be safe, effective, and above all, meeting patients' needs. My background is that I have 25 plus years now in specialist palliative care and oncology nursing. And even though I'm in more of a leadership role now, I retain my place on the nurse register, which is incredibly important to me. And obviously, in terms of the subject matter today, I'm often doing lots of training on having those difficult conversations. It's something that people often don't know where to begin, don't know what to say, importantly, don't know what not to say. So hopefully we'll be covering all of that and answering any questions today.
Excellent, thanks Michelle, thank you for that. And clearly Michelle is the real expert in the room here, so I'll be trying to put it all together, helping you through the topics, making sure that the information is useful to you, giving you some tips and guidance, hopefully you can take away and use in your workplace and beyond. So I'm just going to tackle a number of things. What we're hoping today to give you is a real view on the landscape in terms of why these conversations are increasingly important. We'll tackle things like empathy, sympathy, and the difference between the two, how we should tackle privacy as well to make sure that a person's wishes is properly understood, particularly around cancer and sensitive conversations. We'll also look at how you might tackle that in terms of conversations, the things to say and things perhaps not to say, to help those conversations be effective and useful for the person you're dealing with. So let's move on to the first part of this presentation. So Michelle, what we're really trying to get a sense of here is how you would tackle the first part of a conversation. Somebody's indicated there may be a difficult conversation ahead. What are the kind of things you need to prepare yourself for in terms of getting ready for that conversation you might have?
I think the preparation is incredibly important. People will always remember what that first response was like. How they might not remember the words, but they remember how you made them feel. So the preparation is incredibly important. You need to be thinking about things like the environment that you're going to be having this conversation in. Is it an open plan office environment? If that's the case, then definitely rethink and go somewhere where you know that there's privacy to have that conversation. Also start to have an understanding of what you can and can't offer. You need to go into that conversation prepared and know what your policies say. If you know this is going to be a conversation about cancer or about anything sensitive, then actually, what can you offer? What can't you offer? Just be clear on that from the beginning. Obviously, if it's a conversation that you're not expecting and turns out very quickly to be about cancer and you're not prepared for that, it's still okay to acknowledge that you'll need to come back to them with questions. And importantly, don't overpromise if you're not sure about what you could or couldn't offer as an organisation. Just make sure that you hold that space where you're taking in the information, but you're very clear that you'll go away and find out things. Making sure that also wherever you are, whether that's a virtual conversation or an in-person conversation, you have a place where you're not going to be disturbed. So obviously, if you're in an office, try and book a private room, put something on the door that makes sure that you can't be disturbed. If it's a virtual conversation, turn the emails off, turn the Teams chat off, and make sure that others know not to disturb you in that time.
Excellent, thank you. I think what might be wise for us here also is to just indicate some of the cancer landscape stats that make these conversations more prevalent, perhaps in the workplace. So I'm just going to share with you some stats that we've pulled together. Now, what we're trying to do here is focus on cancer in the working age population. We're seeing some stats come through from a number of sources now, which indicate that the age group is shifting in terms of cancer incidence. But to give you a broader view, we know that best part of 127,000 people a year are being diagnosed with cancer in the UK, year in, year out. Also, we know that a large number of people, 900,000, predicted to be beyond 1.15 million by 2030, that people are living with cancer. So again, a number of the working population will be living with cancer, and in your organisations, I'm sure you'll experience that already. Equally, we know that unfortunately, a lot of the cancer cases are diagnosed at the latter stages, stages 3 and 4, which has quite a negative impact on outcomes. So getting into dialogue early, having conversations earlier are really crucial in terms of people's outcomes. So important thing to remember. But equally, what we're starting to see from the reports and research is that there's definite increases in people of working age who are having cancer, 22% increase in the 25 to 49-year-old age group, a research piece from Cancer Research. So the likelihood of having the need for sensitive conversations in the workplace is increasing all the time. So important stats to kind of frame the conversation, indicate that you know, we all may be touched with these kind of challenges over the coming years, months. You may already have had those challenges to deal with. So just to give a foundation for that. Okay, so if we now move on to privacy. We've touched already, Michelle, on the need to make sure you have a private space, make sure you understand exactly what's required of that individual, but give us a sense of how you might tackle that conversation. What type of considerations might you give to them in terms of how private they need to give the information and how you might deal with the information they're giving to you?
What we do know is that a number of people still choose not to tell their employer when they have a cancer diagnosis. Indeed. And the most important thing is that you're building an environment where the person with a cancer diagnosis feels that they can trust you. So that building of trust, that relationship, is that the foundation that you've put in place is incredibly important, because cancer is now often seen as a chronic illness. So this isn't a conversation you're going to have once. You need to set that tone so that this onward conversation that might take place over a course of years, that person knows that they can trust you. You're going to hold their confidence. You need to agree how much of their diagnosis, their treatment, that they want to share. You know, for some people, they just might want you to know the diagnosis, and that's all you're ever going to know, and that's fine. You can still work with knowing that. Other people will be incredibly open, and they will want to know, they want you to know about the treatment, the side effects, everything that they're experiencing. So it's incredibly individual. The more that you are able to work with a person and the more information you can have, the easier it's going to be to support them, but you have to build that trust in the first place. One of the really important things you also have to understand is who already knows. So the likelihood is they will have shared it with people that they're close to before they'll have shared it with their line manager. So understanding who else knows is so important, because it helps stop that whole kind of Chinese whispers thing. And actually, if friends have chosen to share that information, you have got a foundation to understand and agree with the person that actually you've kept your end of the bargain and you've not shared this. However, you already agreed that 3 other people knew. And if something has got out that wasn't intended to be shared, you can go back and look at the source of where that might have come from. So incredibly important to know who knew before the line manager or the HR team.
And I guess what a follow on from that is, if you're not necessarily a line manager but a colleague, how would you tackle that? Because clearly there's some challenges in terms of how you might pass the information on. How would you take care of that?
I think if you're a close colleague, it's different because you're probably going to look at it from a friendship side of things anyway. So the conversation is likely to be a lot more open. People will be telling you a lot more about how it's impacted them emotionally. If it was a colleague that you're working alongside, but it's purely a working relationship, then actually the conversation might be more around workload and very practical kind of steps to help address the fact that yes, you're going to have to, as a team, find a way to support this person with a cancer diagnosis. It might be looking at things like, as a workload, if this person has to go frequently for treatments or follow-ups, appointments, scans, etc., or they're going to have periods of time where they have to have a couple of days out because of the side effects, and that's the cycle of treatment, then as a team, how can you collaborate and make sure that you're doing the best, one, to make sure that that person's supported, but two, that you're addressing this as a team, because we don't know the impact that other people in the team might have. So if they're also touched by somebody who has cancer or any other life-limiting illness, it might also be bringing up some personal impact for them. So by being aware of this as a team, it just helps a more collaborative approach. Again, if you've got somebody who isn't willing to share it, but you found out about it, then wait for them to share it with you. It's not your news to go with.
Absolutely. Okay, thank you. Lots of considerations around empathy and sympathy and the differences between the two. So certainly something that you're familiar with on a daily basis. Could you take us through some of your thoughts on the difference between the two and how you might practice those? I have some slides just to give the examples for the audience here.
Lovely. So there is no doubt that both come from a place of good intention, no doubt at all. But actually, when you break down the psychology and when you break down the research that exists, what we do understand is that sympathy can inadvertently create a hierarchy, because the wording that you use is coming more from a place of conveying your pity or your sorrow for that person. And you also convey it in a way that talks about how you're feeling. So it would be, Sean, I'm sorry to hear you feel that way. So I'm telling you how I feel about your news.
Yeah.
Whereas empathy encourages us much more to walk alongside that person. So as your manager, I want to understand how it is for you. What can you tell me that will help me understand the impact this is having on you? So you will use phrases such as, that must be difficult for you. Tell me more. It's a much more open conversation. So sympathy is, it's a closed approach to communication, because you're stating your emotion, you're stating you're sorry to hear this news, and again, genuine intention, but there's nowhere for that person to respond. Whereas this must be difficult for you. Actually, then you've got a way to open up that conversation and say, actually, yes, it is, or thank you, but you'll close that conversation down. It's your choice at that point.
Excellent, thank you. And I think we've got a checklist almost in terms of how you might practice empathy with some ideas here. Can you run us through a couple of the key points here?
Definitely. So body language is incredibly important. And again, you'll get the gist of how much someone does or doesn't want to share with you. If they are open and they're giving good eye contact, then actually, you know, you've probably got a bit of an open door here to build some trust, build rapport, and get that conversation moving. If someone's avoiding eye contact, it might just be that they're very uncomfortable. It's, you know, it's really difficult territory to tell someone that you know that you've got a working relationship, that you've got this life-changing diagnosis.
Yeah.
It's big news to share. So eye contact isn't necessarily a way of avoiding things. If you notice it, then actually just gently try and bring the person around. So it might be that sitting side by side, I know you and I are having eye contact at the minute, but you'll very often find that a side-by-side conversation is a lot easier when you're having a really sensitive conversation, because there isn't that intense pressure. So it's a lot easier to have a side-by-side conversation. The person can look away quite comfortably, but still be open in what they're saying.
Yeah, absolutely. And challenges around remote workers and having to deal with conversations even of a sensitive nature on a video call or some sort of Teams or Zooms event. What kind of things would you be looking at for that?
So this is really where you need to know your team member in the first place, or your colleague. So you'll know what their usual style is on a video call. So this is where you'll really look for those subtle changes. So if somebody is usually very engaged, then you'll see that potentially they're looking away, they're looking down, potentially the video is even off. So if that's happening, maybe you just need to either offer them the opportunity to take the call later on. You can see that, acknowledge that you can see that this is difficult for them. Ideally, what you really want to do is facilitate a face-to-face conversation when you're dealing with anything sensitive. I do appreciate that some organisations are virtual only, but wherever you can, even if you can make the exception to sort out hiring an office room, something this big deserves a face-to-face response.
Okay, thank you. And obviously we're talking about sensitive conversations around cancer, but I'm hopeful a lot of the information we're passing over today will be more broadly useful to you around conversations in the workplace that may not be ill health related. But clearly what we're trying to do here is focus on cancer and the difficulties that causes for people. And I think to some extent there's still stigma around the word cancer and dealing with conversations around it. People shy away from it perhaps, are not comfortable with it. Any tips in terms of how best to take care of that?
Definitely. I think don't try and position yourself as an expert. There's no need to be. You don't need to know about the type of cancer that this person has. You don't need to know about anything in depth. They will have a supporting clinical team that will give them all of the support regarding anything that is illness specific. So what you do need to understand is how to be that support. And that's the most important thing, in terms of making sure that you're going at their pace and understanding that it doesn't matter if you also have the same diagnosis at the same age, doing the same job, it will still be a very different experience. So making sure that you are treating this as it's only ever happened to them, this is their story, this is about them, that's the most important thing that you need to remember.
Yeah,
take their lead.
A real focus on them as an individual and bouncing off their requirements, bouncing off the indications they're giving, and responding in a way that reflects that. Okay, thank you for that. We'll just get another popular topic, which has been something that is very topical now. It's how we might tackle conversations of a sensitive nature with a neurodivergent audience, an individual. We've got a number of tips here. Can you take us through a few of these? Just give us a sense of how best we focus on that individual's needs, how we deal with conversations which perhaps are non-typical in terms of helping them. Could you take us through a few of those?
Yeah, of course. And I think the thing to remember here is this is an individual approach as well.
Yeah.
So how one person with a neurodivergence might respond isn't the same as another. So we have to make sure that, again, it's about knowing that person as an individual. So if you've got somebody that gets distracted very easily, that private environment is going to be really important. If you know that somebody cannot deal with noise, then again, find a quiet environment. Making sure that you understand their preferred communication style. So a number of people might find a face-to-face conversation quite intimidating. Go with their preference around that. And actually, if they find a virtual call easier, then go with that. Some people just might not physically be able to talk about it. And that doesn't have to be anyone affected from a neurodivergent point of view. You might just find that staff generally cannot find those words in the early stages, and that's okay. Go at a time that they're ready. But when we're talking about neurodivergency, if somebody prefers written communication, that's absolutely fine.
Yeah.
You just have to find the style that suits them best, making sure that we're giving them time to absorb the information, because of course we're taking information from them. This is our fact find to make sure we can support them well, but alongside that they also have to absorb some information from us in terms of what we intend to support, how we can deliver in a way that meets their needs. So give them time to absorb that information as well. Incredibly important. And again, it's going back to that empathy. So making sure that we're taking the time to understand how it is to be in their shoes. They might be encountering additional difficulties in terms of absorbing a huge amount of clinical information, the whole pressure of attending scans, appointments, it kind of all adds additional pressure. So understanding their perspective is really important.
So it's a very customized, personalized approach to somebody, a neurodivergent who's neurodivergent.
Yeah.
So it's making sure that you match the requirement in terms of how you respond, how you understand their requirements, and equally the place that you might just have these conversations in. All very important factors.
Absolutely.
In terms of that. Okay, that's really useful. In terms of what to say and what not to say, very important. Equally, perhaps a little confusing for people, a little bit scary, perhaps, in terms of what you could and shouldn't say. So if I can just move on to that part of the webinar now. There's certainly things you should avoid saying, and I'm sure you can give us some examples of those, and we'll come on in a moment just to the kind of things that might be helpful in terms of getting a dialogue going, encouraging the conversation. So could you run us through just some examples of things to avoid, the words or phrases or sentences that are not helpful in these situations?
I think firstly, it's really important to understand that no one is a master in good communication. We all still learn, 25 years plus on, I still learn, and occasionally, if I get it wrong, I'll build that into my learning, and that will happen in any working relationship. If you're trying to support someone through an incredibly difficult time, there will be things that you say that you wish you hadn't, but learn from it. It doesn't mean that you can't do the job well. Communication is something that we're constantly learning around. So in terms of things to avoid, the first thing that we've listed obviously on the slide was to avoid terms like battle, strong, journey, but actually it's also important to have an awareness that some people will prefer to use that language. So my advice there would be to match the language that the person is offering you. So if they are in battle mode and they're talking about fighting the cancer, then you mirror that language back. For other people, they will be very kind of clear in not wanting to be seen as a cancer warrior. They will want to be seen as a cancer patient, and they will have anger and resentment that this is happening to them. So they don't want to fight it. They don't want to be that warrior. So definitely mirror the language that the person with the illness is offering you in the first place. Make it about them. So it doesn't matter if you have had cancer yourself or 7 or 8 people that have. It's really important. It might make your empathy stronger because you have that personal experience, but it's still incredibly important not to share that unless the person asks you. If you previously had a diagnosis or were impacted and you openly spoke about that in the workplace, you might find that they'll openly come to you asking for your advice. That's the only time I would say you would ever share your experience.
It's a difficult thing to do, isn't it? Because you try and draw parallels to try and comfort and support, but in some cases it actually is a detrimental thing to do.
Definitely. And if you know, or you think in conversation that this person would benefit from talking to others, then signpost effectively. We've got helplines, we've got support groups, there's all sorts of things, and as an organisation we can help people find their nearest support group or source of support. So definitely don't use yourself as the expert. Again, it's going back to what I said before, you're not expected to be that person. Saying things like, I'm sorry about how you're feeling, we've spoken about that, avoid that. Don't say that you know how the person feels, you don't. You might have had a similar experience, but we are not that person. And trying to kind of placate with don't worry, or at least this is a big deal. This is a life-changing situation. Okay,
so the flip side is to the things not to say is the things that you can say that help the conversation flow. So things you could say.
Yeah, so we've got a couple of examples up there, but there are also things like, what would you like the next steps to be? So help that person gain control of the situation. So you're not leading it for them, you're not trying to fix it for them because you can't. Just help empower them by, what would they like the next steps to be? You could say things like, some things we could look at are, because you will have done your prep before the conversation took place. If you don't know, then also it's okay to say, I would really like to have some time to go away and think about things because I want to get this right for you. And there's no harm in saying that. Don't pressure yourself to have all the answers in that moment, because the likelihood is you might mess it up a little bit if you haven't got all of the facts. So you're better off just being honest around that, and then that person is going to trust you all the more for it.
Yeah,
it's that honesty.
Absolutely. And I think that's everybody tries to resolve people's problems, don't they? And in many cases, and in this case particularly, conversation about cancer, nobody can promise that.
Exactly.
So it's important to choose the words carefully. Okay, we've got 5 minutes left, so not long. It's flown by. Just what might be helpful, just to wrap it all up. And we have a checklist here, and we'll be sending the slides around after the webinar as well, so you have something to reference and refer back to. But there's a number of things here that kind of give a flavour and a landscape for how you might tackle a sensitive conversation, how you might deal with it in the best way possible, but also being honest with yourselves in terms of your capabilities. Could you run through a few of these for us, just to try and summarise what we've been through today, and maybe pick out 2 or 3 key points that we can take away and use in the workplace and beyond?
Definitely. So I think, the main things that we've covered are how important preparation is, making sure that you're setting up the environment, now whether that's virtually or physical environment, really do make sure that you're setting the right foundation to have that conversation in the first place. Make sure you know what you can and can't offer that person, making sure that your use of language is comfortable for them and you're mirroring what they're able to tolerate and be comfortable with. Making sure that we're not making any assumptions, really important. Making sure that we are actively listening. So one of the things that I always say is, if you can remember that the words listen and silent are exactly the same, it's just a jumble up of the letters, you'll listen well, because listening well means you are literally absorbing the information. You're not going through your mind, when can I say the next thing, or I need to get this in. You're stopping, you're clearing your mind other than to take on that information. If you can actually practice that skill, and it does take practice, it's the hardest communication skill without any doubt, but if you can practice and hone that skill, you'll be such a strong support for that person with a cancer diagnosis. Remembering that you don't have to have all the answers, you're not expected to be the cancer expert, but you are expected to be that main source of support for the person in the workplace. So just making sure that you're strong enough to do that. If for any reason you're going through something yourself that is perhaps triggering, or you're just about to leave the organisation or move to another department, and then you're not the right person to have that conversation. So equally recognising when that conversation should be handed over is also important. In terms of my main 3 takeaways, I would say treat the person as an individual. This is their journey, this is their experience, this is their diagnosis, and it's only happening to them.
Yes.
Go at their pace. So you might have 3 other meetings to get to, but if they need you for half an hour longer, you go at their pace.
So it's real focus on the individual and their challenges that you're trying to deal with just then.
Absolutely. And make sure that throughout those conversations, whether that they're short term or you're going over these period of years like I've spoken about, then always seek to understand. So use that empathetic approach, because the trust, the rapport, that will set your foundation, and you will get so much more out of that person, which means you're much more readily able to help them, which in turn means they're going to be much more likely to stay with you as an organisation.
Excellent. Thanks, Michelle. It's 2 minutes to go. We are running out of time. That's probably a good thing. It's flown by here for us. Just to finish off the webinar, if you've been personally affected by any of the conversations we've had today, please reach out and we'll support you on that. Clearly, conversations about cancer do trigger thoughts and feelings in people, so if you do need some help, please get in contact with us. If you're needing some business support advice, then the number's there. Give us a call and we'll help you as much as we can in terms of supporting your organisation. We've really run out of time, but equally, the number there, the email there, inquiries@reframe.co.uk. If you have any questions for Michelle, please drop us a line and we'll respond to you. And obviously, as part of this, we'll be sending around the slides to you so you can refer to in the future. But the 30 minutes has whizzed past. We've hoped you enjoyed it. We hope you find some help from that, some insights that you can use and apply in your workplace. And we thank you for your time and joining us today. And we look forward to the next one, which is in a few weeks' time. So please check out our website for our ongoing training series of webinars. Thank you very much. Thank you, Michelle. Thanks for your input. It's been really good. Thank you, everybody. Goodbye.